Community Health Worker Module, Nurse Module. The WatIf application is a tool that is designed to make the dream of a re-engineered primary healthcare possible. It facilitates the integration of community health workers into mainstream clinical work at primary health level through applications that utilize a highly developed medical knowledge base to drive computer-based patient data collection questionnaires and produce high-quality and relevant patient clinical information that is superior to data collected from a physician interview. The current demonstration deals with how a community health worker is utilized to capture standard medical data, such as weight, height, blood pressure, medical history, laboratory results, standard repetitive clinical observations. This data is then processed through a highly developed medical knowledge base to produce meaningful, interactive, and actionable clinical assessment reports to be used by the primary healthcare nurse in his or her clinical decision-making process and care. The community health worker is assisted in his new role by an embedded artificial intelligence clinical knowledge system capable of understanding the community health worker's actions, activity, and outcomes. It provides the community health worker with interactive clinical guidelines and treatment protocols that are specific to the patient and his clinical condition or diagnosis. This is how the unprocessed clinical data collected by the community health worker will look like prior to being processed through the WatIf clinical knowledge base. In this model, community health workers only have access to the unprocessed clinical data, with no any other interpretation of the final clinical outcome from such information. Once the community health worker is satisfied that the data is correct and complete, he then processes it through the WatIf clinical knowledge base to generate an interactive and actionable clinical assessment report that is made available to the nurse.